So I'm Sean Murray. I'm the Medical Director of the Family Child Program and the Chief of Pediatrics here at Health Sciences North. What inspired me to be a pediatrician really is quite complicated. I started off as a youngster receiving lots of medical care and surgical care at the Hospital for Sick Children for cleft lip and palate. And then at the beginning, that's what drove my desire to become a doctor. And then as time went on through medical school and early on and into my career as a physician, the inspiration came from dealing with the kids that I saw as a medical student. It makes sense just hearing the statement, you need to get care close to home. And the first reason is really family driven. So as pediatricians, we are always trained to be very family and patient centered, meaning we really want to focus on the needs of the child and the family that we're looking after. And I think the best way we can start with that is to be as sensitive to a family's needs as possible. Added to that is the fact that there's a lot of strain emotionally, financially, and physically on families when we have to defer care to other places. So if you got to travel to sick kids in Toronto or CHU in Ottawa, that means taking time off work, that means spending money in hotels, that means time away from work, which may not be recuperated from a remuneration point of view. It takes its toll. And then the emotional side of it, so parents and families being separated for great distances over great time does have huge impact. And when you have emotional and psychological strain, the illness is not necessarily going to be healed as easily. My vision for NeoKids is to, first and foremost, provide care as close to home. So it's kind of a mantra that seems to be, iterated over and over again and sound like a broken record, but it really, really, really is important. I think going forward, though, there's more to the NeoKids vision than just care close to home. So making sure it's child-friendly, making sure that we're providing an expertise level here that we've been able to provide to allow people to stay home and receive expertise in the North that we haven't been able to provide sustainably for children. And meaning that someone from the North comes to Sudbury or someone from Sudbury comes to Sudbury, gets their care and stays here for the entirety of their care. Traditionally, that's all been dealt with by, a lot of multifaceted, multidisciplinary care that's shared, but nothing where you get the core of the treatment done in Sudbury. We have the capacity to do that here now. We need the infrastructure to do it, and recruitment, I think, is going to be coming in order for us to facilitate that. So it's that type of care that we're talking about for the Northeast here. So family-centered care, a system of care, and child-friendly care with an extra added expertise over and above what we're already offering is really the vision of NeoKids that I see moving forward.